Hi everyone, and thank you so much for joining today's webinar. Today we'll be diving into some of the most valuable features in Care Control Cloud. Whether you've just joined us, recently moved over from the Windows system, or have been using cloud for a while, these tools are the ones you want to make part of your daily routine. We'll be exploring key features that help you stay on top of quality, safety, compliance, including service status, your at-a-glance view of your service and how well it's performing, care plan integrity checks to ensure every plan is complete and up to date, instant analysis to help you spot trends and take proactive action, staff file integrity checks to keep personal records accurate and inspection ready. But before we get started, just a couple of quick housekeeping notes. If you have joined us before, you'll know that every webinar we record, you can rewatch at any time. You can rewatch any session on the Webinar Hub, which is available on the Learning Hub, and I will include all the useful links that you may need at the very end. This recording will be uploaded there within the next couple of days, so feel free to revisit or share it with your team. And if you have any questions during the session, please pop them into the chat. Lizzie will try and answer them as we go, and if time allows, we'll also have a short Q&A at the end to go over any remaining questions. So that's everything for me for now. Let's get started and take a closer look at how these tools can help you run your service smoothly, confidently, and in full control. So we know how demanding a manager's role can be. Whether you're leading a large care team or a smaller service, you're constantly balancing priorities, staffing, compliance, incidents, audits, care planning, often all before lunchtime. That's why we've built the manager's tools within Care Control Cloud to take the pressure off and help you lead with confidence. What's powerful about these tools is how easily they can fit into your routine. You can use them daily to stay in control, weekly to review performance and spot patterns, and monthly to evidence compliance and leadership. Whether you're new to cloud, recently moved from Windows, or have been using the system for a while now, this session will help you make sure you're getting the most of these features, the ones that make oversight simpler, management smoother, and leadership clearly evidenced. So these manager tools aren't just nice to have features, they're the foundation of effective leadership in care. They give you visibility, structure, reassurance that your service is safe, compliant, and well managed. When you start building these tools into your daily, weekly, and monthly routines, they quickly become second nature. You'll find they work together to help you stay proactive, prepared, and in control. And in many ways, you can think of them as your own management checklist, a quick way to make sure nothing slips through the cracks and that you always know where your service stands. Each day, you can check your live service overview, spot issues early. Each week, you can review performance, highlight areas for focus. Each month, you can evidence leadership and governance to inspectors or senior teams. And the result? A smoother, more proactive approach to management, where you have clarity, control, and confidence that nothing is being missed. You're not waiting for things to go wrong, you're managing with confidence and control. So when inspectors visit, they're not just looking for paperwork, they're looking for proof that your service is safe, well-led, and operating smoothly. They want to see that you have clear oversight, that your team is supported, and that your systems are effective. Care Control's built-in tools give you exactly that kind of evidence. They show that you're actively monitoring safety, quality, making informed decisions, and driving improvement based on real data. The result is that inspectors can clearly see your service is in good condition, well managed, consistent, and proactive. It shows that leadership oversight is built into your everyday processes, not something that happens only when inspection time comes around. These tools turn your normal management activity into clear, traceable evidence of good governance and strong leadership. So what is service status? Picture a dashboard that gives you complete oversight of your service in real time. With one quick glance, you can see your team's sign-in status, shift allocations, tasks that need completing, and any live alerts, all clearly displayed on your screen. It uses a simple traffic light system to show what's complete, what needs attention, and what's overdue. That means you can instantly spot issues, prioritize your day, and take action before small things become bigger problems. And if you manage multiple services, service status becomes even more powerful. And with Map View, you can see all of your services across the UK in one visual, giving an immediate sense of where everything stands. And this just isn't another report, it's your live command center. It saves time, cuts down on paper chasing, gives both managers and senior leaders confidence that everything is running safely and smoothly. Now, let's take a quick look at how this works in practice and see Service Status Dashboard in action.
Okay, the service status on Care Control, a really vital part of the system. It's available on cloud, it's available on Windows, it's available on mobile, it's available on Pocket. Now I'm going to show you how to access that through Care Control Cloud. And to access care planning and service status, you'll need to come to your waffle at the top of the screen. Under there, you'll have all the apps that you have access to. Now, for service status, you will need to click on the care planning app. As you can see from here, in the bottom left-hand corner, you've got the service status. Now, how this looks depends on your service and the number of sites that you may have responsibility for. For me, I can see multiple services, multiple sites. I am responsible for all of them. If you are an individual service and you only have access to your service, your status will look like this. Now, it works across 5 areas. So it looks at your sign-in status, so it's talking to the rota. We can see here all of the staff that have not signed into the system at the start of their shift. Now, this has a big knock-on effect. If you're using Care Control for things like your payroll, for example, this is a really important place to come. Make sure staff have signed in. If they haven't signed in, go and ask them to sign in. Remind them that they need to sign in. If they haven't signed in because they're not at work, you need to go in and you need to adjust the shift time for that staff member on the rota. We've also got on here shift allocations and client tasks. Now, the client tasks is a big area, okay? This is available for staff to see, for seniors to see, for nurses to see, for managers to see. It flags up anything that is client related. Okay, so this could be anything from monitoring, it could be risk assessments, it could be consents, mental capacities. Such an important area. Whoever is leading your shift, they really need to keep an eye on the service status to make sure that staff are recording as and when they should be, and that everything is being evidenced as you're going along throughout the day. Now, I'm going to use activities here as an example. At the top here, we can see we've got 7 issues which are highlighted in red, and we've got 6 issues which are highlighted in orange. It's still the traffic light system that you see throughout Care Control. The red issues means that there is areas here that have not been recorded for my clients. Okay, it needs immediate attention. Orange means that it's due to be recorded. Now, if I click on the I button, we can see exactly what's going on. So we can see which clients are now due to have an activity recorded for them. And we can also see underneath who has not had an activity recorded for them within that time period that you guys have set. Okay, now I think my activities need to be recorded at least once a day. From room 7 to room 15, they have not been recorded. So we will be asking questions as to why. It's laid out a little bit different than it was on Windows. Okay, we've now bulked it down into categories. So instead of having lots of activities on show, we can now see that it's activities, and we can see what the issues are. But you can also have a look at that in tasks. You've also got your status here as well. So we can have a look at just due areas. We can have a look at overdue. Okay, so this is a really important area. Now, like I said, the client tasks are client related, so it does flag up when care review assessments are due to be completed and overdue. You can use the service status to go through to a particular area. If I was to click on one of these care review assessments, it would open up the care review section for that client on their care plan. So it'll allow me to go straight in and record that information. So this area is very interactable, okay? You can go in, you can click an area, it will take you through to record that information. Underneath resident tasks, we've got other tasks. So these are areas that you've added on to care control. Now, these can be anything from watering the flowers to staff top file integrity checks, making sure they've been completed, audits of first aid boxes, okay? Whatever you add on to care control as an other task will flag up here when it is due to be carried out. Now, those tasks could be daily, they could be weekly, they could be monthly, they could be annually, okay? You decide the frequency of those tasks when you're adding them on. Now, like I said, this is available on all of the devices. There is no excuse that staff can say, oh, we didn't know that that was due. It shows on the service status where there is an area that is due to be recorded. And it's really simple. If it is flagging up, you need to record a response to that. So we can see here, we've got an audit of controlled drug. If we click on here, we can mark this as completed. We can add additional information. So I'm going to mark that this is completed and add in here, all completed. Obviously, you guys would have additional information around that. Now that has been removed, okay, because it's been recorded. When it's next due, it will pop back up again. We also have alerts on the system. Now, alerts are so important. You guys are doing the work, you're recording your information, you're adding it to care control. Let care control help you guys, okay? So your alerts, you can build them onto the system. We tend to recommend having approximately about 32 alerts added onto it. As soon as something is triggered, that is an alert word, the system will flag it up. It will email you to let you know. Now, what you will need to do is you will need to come into alerts and you will then need to sign off that notification. So we can see here we've got a health issue, an alert for when a new health issue has been recorded. If I click on the I information, it's given me more details about that health issue that's been triggered through the alert system. The deputy and the registered manager are the two members of staff that have received this alert via email. So it is these two members of staff that need to come in and need to sign it off to make sure that the system is fully aware that they know this has happened, okay? System's flagging it up, you guys need to acknowledge it. It is so important. Now, these tasks can work with things like your medication as well. It can work with things like incident forms, particular phrases or words. Hospital, seizures, anything along those lines can be flagged up in alerts. The home status can also be visible as well on the pockets and the mobiles. We just close this down. On a tablet device, the home status is here, or it's called a service status, okay? The service status is an icon of a house, and then you've got your green, your orange, and your red. This is where whoever is leading the shift will be able to see how well everything is being recorded, making sure your staff are all signed in. We can see here we've got a staff member that's not signed in, so we'd be going and speaking to Dawn, asking her to sign in. You can view your client tasks. Okay, again, it's interactable. If you've carried out one of these areas, click on it, record that information. Okay, so it is interactable. You can use the service status to record information. You can sign off other alerts. You can sign off tasks from a mobile device. On the pocket device as well, the service status is up here. So it's on the pocket devices, staff do have a little icon up here with their initials. If they select those initials, they've got the service status. Again, it's the same icon, okay? And again, it's laid out in exactly the same way. You've got your 5 areas. You know, if you're leading a shift, keep an eye on your client tasks. Make sure things are being recorded. Now, for me, it happens to be about 3:30 right now. I would be wanting to know why, let's say, for example, if we scroll on down here to personal care, why my personal care has not been recorded, why my foods might not be recorded, why my fluid. To me, I need to evidence that. You guys need to evidence that this is being recorded. So it is so important just to make sure this area is being used As soon as an area gets recorded, it does remove from the service status. So at the end of the day, what you are looking for is all green ticks going down through here.
So, care plan integrity checks give you real-time view of how accurate and complete your care plans are. It systematically reviews every plan across your service and highlights any missing or outdated information so you can instantly see what needs attention. You'll also get live warnings, errors grouped into categories showing which service users need updates. It's a quick and reliable way to make sure every care plan is accurate, person-centered, and compliant without the hours of manual checking. Many managers use this tool weekly or fortnightly as part of their regular routine. It's also a great way to evidence good governance and ongoing quality assurance during inspections. So let's take a look at how this works in practice.
So the care plan integrity check, again, a really useful tool that we have on the system, doing a 24/7 audit of your care plans for you. Now, to find your care plan integrity check on cloud, you will need to go into your admin app. Okay, so again, where the waffles are, if you select admin, that'll bring you through to your administration page. And then if we select care planning, one of your options is care plan integrity check. Now, this used to take me ages to do when I was working at care. To check everybody's care plan, make everything's up to date, used to take me ages. This has done it for me in that space of time. Okay, so by literally 3 clicks, the system has done an audit for me on my care plans. This is working 24/7 in the background for you. So as soon as an area gets updated, it will automatically update itself here in your care plan integrity checks. Now, what the system is showing me is that I have 89 errors showing in my care plans, okay, for 15 clients. I have 43 warnings. You can also see the top 10 residents with the most warnings and errors. And we can see here that Olivia is the highest client with the most missing information from her care plan. On the right hand side, this is broken down into categories, so we can see each area here that is missing information. Now, if I select one of these particular icons, and we're just going to go for care review, as you can see, it's letting me know exactly whose care review. Now, if I select that button again, it will take me right through to Isabel Martin's care plan, and it will allow us to start a new care review. Whereas on Windows, when we did our care plan integrity checks, it was very rigid, as in you could see what was missing, but there was no links to that particular area. Whereas now on the cloud, you have the ability to link errors that are missing from a client's care plan to their actual monitoring area that needs to be recorded. On the right hand side, we've now broken it down into categories. Okay, so we can see here, for example, we have one care review here that is now overdue. We have do lots of activities that haven't recorded, etc. If I select my clients, okay, as you can see, it's breaking it down. So we can see that actually Olivia has got 13 errors missing from her care plan. And again, if I go in and select those 13 areas, it breaks it down even that little bit further. Okay, so we can see exactly what is missing from the care plan to do with Olivia. Now, if I actually click on one of these particular icons, it actually takes me through to that section of Olivia's care plan. So we can come in here, we can then add that information. So it's all very, what's the word I'm looking for? Very linked together, very interactive, okay? On the Windows version, the care plan integrity check was very rigid. You could go in, you could have a look at the care plan integrity check. You can actually action anything from there. Whereas now with the care plan integrity check on cloud, very interactive, it lets you go through to that section that needs the information adding to it.
So incident analysis is all about turning data into insight. Instead of looking at incidents individually, this tool helps you see the bigger picture, where they're all happening, why they're happening, and what can be learned from them. You'll get a clear, digestible dashboard showing trends by location, time, incident type, and cause. You can even see detailed summaries, who was affected, helping you understand the full context. This makes it much easier to identify patterns and take action to reduce reoccurrence. It's also a great source of evidence for your quality and safety meetings, showing that your service learns from events and continuously improves. So, let's take a quick look at how Incident Analysis Dashboard brings this data to life.
Okay, so where are we going to find incident analysis? Okay, again, it's underneath your admin app. Okay, so select admin, and then what you'll need to go to is you will need to go to your common options. Underneath common options, you have got incident analysis. You've also got care plan integrity checks in here. Okay, so you may find certain areas popping up twice. Incident analysis, okay, this is now having a look at the incidents over the last 12 months. You can filter your date range, so you can use custom if you want to put in your own particular dates. You've got your incident type, your injury types, your location, so you can filter all of this information out. Not only can you filter it around incident types and injury types, etc., you can filter it for clients and for staff only if you needed to. Now, we have got the overview here, so we can see that we've had 98 incidents recorded in the last 12 months. That does break it down. The overview will break it down for you, okay? So we can see where most of these incidents are happening in clients' bedrooms. We can see the time frames where this is happening most, the highest incident type. You've also got your analysis, okay? So that's a really useful tool to see your analysis around incidents. And we've got the details as well. Now, the details will actually hold the information around that incident that took place. So this will actually show you the incident form that the staff recorded, and you can come in and you can add your post-incident log. So what you've done to prevent that incident from happening again, any of your follow-up actions, anything that is linked to that incident that needs to be logged can be recorded under the post-incident log entry. And finally, you've also got your workflow from here as well. Now, if we just pop back, you can now see from your incident analysis your master log as well. So if you do want to come in and have a look at all of your incidents that have been recorded as a master log, you can do. You can export the data from your incident analysis as well, but we've also, oh, hang on, where's it gone? I skipped too many places. Hang on, go back. We've also got the analysis with Margo AI on here as well. So if you do want to run an analysis to do with Margo AI, you've also got that option from here as well.
Staff file integrity checks give you full oversight of your team's compliance and documentation. You'll see a clear dashboard showing all the errors and warnings against staff members within your service, grouped by category, so you can instantly see what needs attention. This includes missing or expired training, incomplete records, and document gaps, the kinds of things that easily slip through the cracks without a central view. The tool is designed to highlight what needs doing and to guide you straight to the areas that need updating, saving you hours of manual checking and admin time. It's especially useful before inspections or audits, as it helps you demonstrate safer recruitment, ongoing compliance, and good HR governance, all essential parts of being safe and well led. Let's take a look at how this dashboard works and how it helps you stay on top of your team's records.
Okay, so your staff file integrity checks are kept under HR. Okay, so again, if we go to the waffle and select HR, the first thing you are going to see is your staff file integrity check. Now, very similar to our care plan integrity checks, this is doing a 24/7 audit of your staff files. So it will flag up if you are missing training, if staff are missing any supervisions, if those are due or overdue, information around DBS checks, but you can now change that name DBS checks. If you're, if you've got a service that's in Scotland, you can change it because we know it's not DBS. Staff emails, are those on the system? Okay, so the staff file integrity check is really important just to make sure that everything to do with your staff is up to date. It is on the system, so should you need to find that information, you have got it easily available to you.
So, to wrap up, we know how much potential there is with the tools that are being used consistently across your service. Each one has been designed to make daily management smoother, oversight simpler, and leadership stronger, giving you the confidence and evidence you need to show that your service is safe and well led. We hope today has given you some guidance on how to build these tools into your regular routine and make them a natural part of how you manage. The more you use them, the more you'll see the benefits, saving time, gaining clarity, having complete confidence in how your service is running. Care Control isn't just a system that records data, it's a management toolkit designed to help you lead with confidence, clarity, and control every single day. So, I haven't seen the chat in Teams yet, so I don't know if there have been any questions or if Lizzie has been replying to you. So, if you have any more questions, we do have about 3 minutes left of the webinar for the time today. So please insert your questions into the chat and we will get right to them unless Lizzie has already done it.
I think I've been answering them as we've been going, Tiggs, to be fair.
Amazing.
There is just one thing, and I'm not quite sure how easy this is going to be to do, Tiggy, but can I share my screen?
Yeah, of course you can. Let me just stop sharing.
Bear with me 2 seconds, just need to bring it up. Hang on. So I just wanted to discuss with you. Obviously, with the service status, some of you may have areas that are showing frequently, such as ABC monitoring, behaviour, etc. I just want to point out that when you're setting up your monitoring areas, you can also set like the frequency. So some of your red crosses may be because you've got the monitoring that has been set for too frequent of a time. So if you go into your monitoring and alerts, which is under care planning, select your clients. As you can see here for Wyatt, we've got ABC behavior. Now, if I select the I button, okay, that is set for days and never. Now that means that Wyatt's monitoring for ABC is on the system. It can be recorded at any point throughout the day. It's just not going to flag up if it's not been recorded within, let's say, 2 hours, for example. Now, I've worked in care, okay, and I know that sometimes some of you may be speaking to CPNs with regards to behaviour. It could be that maybe a client's had a change in medication and you need to keep an eye on the effects. So you may put somebody on an ABC behaviour monitoring for that. Now, when I was working in care, if I was in those situations, I would set behaviour in the ABC to be recorded frequently, so maybe even every 2 hours. But unless I actually needed to gain that evidence on a regular basis, I would have things like ABC behaviour, behaviour monitoring. I'm using these just as an examples, set to never. Okay, so it is there for staff to record as and whenever, but it never flagged up. And then if I needed to change that, I could go into the individual. Let's say, for example, someone's had a change in their medication. I could then come in and I could edit the record and I could change it to once a day, or I could even change it to every so many hours. Okay, so it's really important just to make sure that the monitoring that's on the system is set for the frequency. Now, don't all go running off to monitoring and change everything to never just to get rid of your red crosses, because that's not going to work either. Just make sure you go through all of your clients, make sure the monitoring is all set to the time frame that you require it to be set to.
So we are coming up for time for this webinar today. If this is your first time joining the webinar, we normally send out a recap email within a few days after the webinar has taken place. That email, the recap email, will include all the links that you need. So whether it is the Learning Hub or the link to the Webinar Hub, which is where we host all of the other webinars that we have done previously, we will include all of those links. Along with that will be a PDF file with all the questions that you have asked today. So for that, you can then go back onto these questions and look at them at any point within the email. So my advice to you would be to keep an eye on your email inbox, because that will be with you very shortly.